It's an unwelcome notice for GE retirees who counted on having medical insurance from the company.
WDRB's Samantha Chapman explains why former employees have ill feelings toward the company and its union. Samantha?
Thousands of GE hourly employees and retirees, I should say, were sent letters saying they would have to find their own coverage. And one tells me he feels completely blindsided.
I enjoy my job. I enjoy the people I work with.
For Wayne Gunnell, working for General Electric was something he once bragged about. He received a letter in the mail that would instantly change his views on the company he once loved.
We're going to lose our health care benefits as we know it now.
For years, General Electric has offered a supplemental Medicare insurance plan to hourly retirees over 65. The plan picks up costs that Medicare doesn't cover. But as of January 1st of next year, GE retirees nationwide will have to find their own coverage through a private health care exchange. GE will pay only up to $1,000 per retiree for 2016. In a written statement, a GE spokesman says, quote, "Our program is consistent with trends among large companies. It allows GE to offer greater choice in coverage while striking a balance among our obligations to employees, retirees, and share owners."
But my dad always told me, if it looks like a lemon and it smells like a lemon, more or less, it is a lemon.
Last year, GE announced that salary retirees would no longer get the company-provided health care plan and were offered the same exchange and reimbursement options. Two former salary workers sued the company over the change, which is still pending in federal court in Wisconsin. That's why Gunnell says the union should have seen this coming.
Our union should have stepped to the plate and asked to support our retired members more than what they did.
While GE's union has no official obligation to retirees, Union President Dana Crittenden says he will still fight for the former workers.
Changes to the retirees, it's hitting home to all of us. And my message to the active employees is that, one day you will be a retiree. So, we have to find a way outside the system to represent the retirees.
Gunnell fears that medical history will now be a factor for retirees when applying for the new plan, which will cost him much more.
I'm just kind of like the average person. I know very little, but I know enough to know that I think it's going to affect us financially.
WDRB.com business reporter Chris Otts has more about how GE stands to save big money from this change. Samantha Chapman, WDRB News.
But to do all this, you must have had quite a savings program.
My savings alone, Ted, wouldn't have been enough. The General Electric pension plan was a tremendous help. I only contributed a small part of my earnings toward my pension. The General Electric Company contributed too, even more than I did.
That isn't all. We even have medical expense protection that General Electric makes available to pensioners.
Ted, today Estella and I have very few worries.
Well, thank you very much, Mr. and Mrs. Sullivan. In 1912, the same year that Mr. Sullivan began his career at the Erie plant, the General Electric Company established its first pension plan.
Let's look at one exchange and some example rates from around the country. These are just randomly picked from 4 different states. Here we're looking at Charleston, South Carolina, a female 65 years old, and the lowest rate on Plan G, which I believe firmly, if you haven't seen the video, Plan G is the best value plan out there. So Plan G, they only offer, look at this, 2 companies. 2 companies. There's over 30 in the market. So their least expensive plan on Plan G is $140.50 for a 65-year-old female. Our rates as an independent brokerage shows us that we have all these different companies down there, right? Including the ones that they're showing. But if you want the best deal, it's Aetna, who happens to be the biggest in the market. Aetna at $96.88, or you go through the exchange and pay $140. That is, what is that, $44 a month in difference? $44 a month times 12, that's $528 in your first year difference. That's your money that you could have spent elsewhere for other benefits and also as a cushion, because remember, all of these plans do go up. ever so slightly, but they do go up every year. Let's compare Plan F, same marketplace, Charleston. They're showing the cheapest one is 150.07. Let's look at our independent calculator here. Look at the least expensive Plan F in the marketplace. It's loading here. Put them side by side, and you can see Heartland National at 121. Theirs is 150. That's $30 a month in difference. $30 a month in difference times a year. That's $360 that you would lose by going through their wonderful exchange with all of these options, which are really only two. Let's go into a different market. This is area code 60606. And where is that? That's in Chicago, Illinois. So in 60606, the cheapest Plan G you can get is 134 through Blue Cross. Notice how many plans they're offering. Three plans they're offering in the marketplace. The best deal is 134. As an independent broker, I've got Mutual of Omaha, the oldest in the industry, 104, and then it goes up from there. Their rate was what, 134? Look how many companies, here's their Blue Cross at 134. Look how many companies they're not telling you about that are in the middle there. And all of these are good companies. Loyal Christian Benefit, here's Aetna, Government Personnel Mutual, CSI, IAC, Cigna here at 124. All of these options you're not getting because you're in the exchange. That's Plan G. And just so you know, on Plan F, similar results, showing the least expensive at 149. And if we look at Plan F, same marketplace, again, it's loading all the carriers so you can see all the choices. The best rate should be, instead of 149, it should be 131. Again, Mutual of Omaha, a great company. So what they're not showing you everything. Here's where they start down here at 149. And all of these companies, A-rated, A-plus rated companies, are much less expensive, which leaves more money in your pocket to cushion you against rate increases and provide more value so you can buy other products. Let's look at another one here. This happens to be Kansas City, Missouri. Kansas City, Missouri, they offer a whopping 3 plans and only one that has Plan G. That's $204.82, $204 for a 65-year-old female. That is robbery, folks. So here we are, Kansas City, looking at Plan G. $135 should be the price, $135. And instead, they're charging you a lot more. How much more? Let's take a look. 204 minus 135. That's $69 a month. That's $800 in your first year of your benefits is gone because they don't shop the market for you. Okay, let's look at Plan F, a popular plan. The least expensive in Kansas City is $197 they're showing. Let's look at the real mark and see what the market has. Again, they're showing $197 is the least expensive one. Really? Transamerica, huge A-plus rated company at $146, IAC at $169. So look at that. They're not even showing half the companies that are in the marketplace. And let's look at just another one here, just so you know. Let's see, we looked at that. Let's look at Houston, Texas. Houston, Texas, all right? And in Houston, zip code is 77010, 77010. Plan G available. There's only one that they're offering, just one. 3 companies again, 169, and the best rate is 111. Look at all the companies between the best price and what they're showing. There must be 15 different companies there they're not sharing with you. Okay, and lastly, just so we're not picking on 65-year-olds, because most people are over 65 if they're already on Medicare, this is Rogers, Arkansas, where I have family that lives. Looking at Plan G on the exchange, the options are Humana or Loyal American. Neither one known for having cost-competitive plans, but let's just look at a 70-year-old female, born in 45, 70-year-old in Rogers, Arkansas, Plan G. The best rate should be $113.25, and instead of $113, it's $149. $149 minus $113 is $36 a month in difference, or half of the monthly budget that they give you. So let's switch over and look at Plan F. Plan F, same market, 70-year-old female. Least expensive is $159 with all of these choices that they show you, just 2. And the least expensive really should be Same market, same coverage, same plans, same benefits and everything. Put these side by side. Philadelphia American at 132. Bankers Fidelity, CSI, Medico, all these different choices. They start at 159. The real market starts at 132. So the choice is yours. If you're going to do going through an exchange because they offer you so many more choices, why not going through an independent brokerage that offers you everything in the marketplace?
Be dancing, and she's beautiful. Again, Angela was lucky here because she got the rehabilitation, and the insurance company said she won't be billed for it. But Jamaica Hospital says it still hasn't been paid by Oxford and doesn't think it will be. In fact, the hospital's parent company is suing Oxford in federal court over issues just like this one. And Kate, you know, we talked to a lot of experts who say patients aren't as lucky as Angela very often, that they get turned away by the hospital, and that this is something people have to think about.
Let's point out what the difference is in Angela's case. That letterhead from ABC News.
Maybe. This hospital, to be frank, Jamaica Hospital is lobbying very actively on her behalf. But
so it could be partly that, too.
It could. But we like to get involved in these things because you see someone like Angela, and it takes your heart, and it hurts it because
but
you
want to wonder how many other patients out there could use a letter from someone like you to go after the system.
That's exactly right. And that's why we do the stories, because the more people know about it, the more we pay attention, the more people there are to help people like Angela. It's time now for the weather.